how our conference is looking at the relationship between human health, animal health, and the health of the environment. Well, the environment threw us a little bit of a curveball this morning, and several of the flights coming out of Anchorage got canceled. So unfortunately, our second keynote, Dr. Ann Zink, is not able to make it here today. But we're very, very fortunate that one of our panel participants today, who's done a lot of work here in Southeast Alaska looking at risk and resilience associated with the COVID-19 pandemic, has agreed to give us a fill-in for Dr. Zink. So please give a hearty, warm welcome to Taylor Van Doren.
What an honor to be pinch hitting for Dr. Ann Zink today. Let's see. All right. So, yeah, it's actually really a great honor to be here. I traveled all the way from Missouri yesterday. Just a little bit of background. I am currently a postdoctoral fellow at the Sitka Sound Science Center and have been working collaboratively with them and the Central Council of Tlingit and Haida Indian Tribes of Southeast Alaska and the RAND Corporation over the last year to dig more into risk perception and resilience during the COVID-19 pandemic in that area. And I'm an anthropologist by training, and I always, have found it pretty interesting that there's not a lot of discussion of pandemics from a One Health perspective in anthropology, because the kind of buzzword of anthropology is holistic and holism and everything all at once, even though almost every pandemic that I can think of has either zoonotic or vector origins. And so it's a really important perspective to have when we talk about pandemics and their impacts and how people experience them. So just a little bit of background in general on how Indigenous communities experience pandemics. The number one takeaway here is that we actually don't know that much. And when I say we, I say Western epidemiological and demographic perspectives that dominate the narrative on pandemic events, how they unfold, and what the impacts are. But those really broad strokes perspectives have come to the conclusion that Indigenous peoples apparently suffer disproportionately severe consequences worldwide, but a lot is really unknown. So there's a lot of lack of data, there's a lot of lack of detailed data, and again, these are very broad strokes generalizations. And in general, health in the Arctic is a little disproportionate compared to the relatively high income nations to which most Arctic spaces belong. The USA is an Arctic nation because of Alaska only, but most of these Arctic spaces, if not all of them, are part of high income nations. But some examples of how these disparities manifest are in that, for example, Inuit life expectancy at birth compared to non-Inuit life expectancy at birth can be about 4 to 12 years lower. And in Nunavut, Greenland, and Russia, infant mortality rates are about 2 to 3 times higher than the non-Indigenous populations of those countries. Why this is important is because circumpolar and health disparities in the Arctic are often very overlooked, even though there are some distinct behavioral and environmental determinants of health in the Arctic, such as like diet shifts and rurality and climate change. Diet shifts, because of climate change, all these things are pretty interconnected. And so what we're looking at is this complex kind of interacting, body of determinants of health through which the COVID-19 pandemic occurred. And so when we are doing our work in Tlingit Ani in Southeast Alaska on the Alexander Archipelago here, we're trying to keep those things in mind. And what we did, so a little bit of background here on COVID-19 in Alaska so far. I should say that so far there aren't a lot of working groups dedicated solely to understanding pandemics in general, but also COVID-19 in Alaska, aside from a few. So Andrei Petrov at the Arctic Center of University of Northern Iowa has done a lot of really great geospatial epidemiological work. The great team at the Alaska Native Tribal Health Consortium and UAA are doing great work. And let's see, I can barely see. And then the work that we're doing at the Sitka Sound Science Center as well have focused exclusively on Alaska populations. Very often when we talk about the experiences of indigenous people in the United States, it's homogenized into Alaska Native and American Indian populations. And it's really hard to tease those things apart on a national level. So what I'm speaking about here is exclusively teams that are focusing on people in Alaska. The first case in Alaska was identified in Ketchikan, which was relatively delayed compared to when the lower 48 started to experience the COVID-19 pandemic. The vaccines arrived in Juneau in December of 2020, and they were very quickly and effectively distributed throughout the territory, most due to the really, let's see, what's the word I'm looking for? The Alaska Native people in Alaska were very on top of this. So the extremely proactive work of people at the Alaska Native Tribal Health Consortium distributing vaccines to rural communities, the Alaska Public Health Association really being on top of it, to the point where Alaska was the first state in the US to open up vaccinations for everyone over age 16 in early 2021. And then by January of 2021, it led USA in vaccinations. Okay, so this is a table of, some epidemiological measures that were published recently by Jim Powell and his team at UAS about, I think these are census borough areas, right? So just some general data here. It looks like the Denali Borough was the one who had the highest number of cases per 100,000 through relatively recently. And then it looks like the Anchorage municipality and the Northwest Arctic Borough had the relative largest numbers of mortality during the COVID pandemic so far. But it's kind of all over the map. There's a lot of differences based on geography, and social organization and things like that. So in our research, it's kind of part of a broader research project where we look at risk perception and resilience, but we've done this through surveys throughout Southeast Alaska and also through in-depth interviews with Alaska Native people of Tlingit. And what we've come up with here was a set of 22 in-depth interviews with Tlingit people that were done by representatives of the Central Council of Tlingit Haida. And we were able to get 5 individuals talking about risk perception and resilience in Sitka, 11 in Hoonah, and 6 in Cake. This is just a little bit of epidemiological data about the number of cases, hospitalizations, and death in these, or to the census areas and boroughs to which those 3 localities belong. So let's see, this is hard for me to see from here, I apologize. The April 2020 through present, that's really like April 2020 through November of 2022. And then the January through July of 2021 data is from the time period for which these data were collected. And what we were able to do was do some in-depth qualitative thematic analyses of these interviews. And when we do that, we really dig deep into the text of the interviews, what the individuals are saying, to come up with common themes among all of the interviews that we're looking at. And we had 4 main themes through which we could discuss risk perception and resilience during COVID-19 in Southeast Alaska. We talked about how people perceived risk, socioeconomic and community impacts, and adapting to public health guidelines and mandates, and coping. And with limited time, I'm only going to talk about these 2, so risk perception and adapting to public health guidelines. But we've also just recently published a paper on this that goes through all of those 4 categories in detail. So in terms of risk perception, this is a table of kind of tabulating how many individuals from each locality discuss that topic in their interviews, and the percentage of the total number of people who we interviewed from each of those localities. So what we were finding was that the one that really jumps out is the threat of climate change, right? Where nobody in Sitka talked about the threat of climate change in terms of COVID-19, but many of the people in Hoonah and Keg talked about the threat of climate change during COVID-19. There was also a little bit of discussion about the 1918 flu pandemic, which I'm going to jump into in a second, but I just have a comment about measuring risk perception. It's a really difficult thing to measure because different people perceive different risks for different reasons, and a lot of the ways that you perceive risk have to do with your own knowledge and risk mitigation. And so this is, again, a difficult thing to measure, but we really tried to focus on what these people were talking about and what they were actually saying. So in terms of the 1918 flu pandemic, a lot of people actually discuss the ways that they use their traditional knowledge and elders' knowledge of the 1918 flu pandemic to draw on their survival abilities and resilience for COVID-19. The 1918 flu hit Alaska pretty hard, and the northwest slope in the Seward Peninsula were the hardest hit. Southeast Alaska was not as hard hit, but it did experience the most cases because that's where Juneau is located. But people talked about the traditional ecological knowledge of how to deal with outside threats that you didn't understand what they were yet, because no one knew what viruses were in 1918. But they talked about ways they were protecting their homes, they were drawing upon each other, and they understood that since they survived the 1918 flu pandemic, they could also survive COVID-19. In terms of perceiving other risks, like I said, in Hoonah and Keg, people talked a lot about climate change and the ecological risks that they were noticing and experiencing in their daily lives. So smaller glaciers and smaller salmon runs and loss of access to traditional lands and the need to migrate and ocean acidification, they said were all regularly on their minds a lot more than the threat of COVID-19, which in a lot of ways speaks to me about how people triage crises and how you think about what is the most pressing issue to think about right now. And when you combine that with the traditional knowledge of surviving the 1918 flu pandemic, you can see how you can draw upon your resilience of surviving acute threats while there are these ultimate threats that are threatening your way of life that may seem actually bigger than the pandemic at any given time. In terms of adapting to public health guidelines and mandates, the people that we interviewed in Southeast Alaska said that they mostly adhered, and it was from a desire to protect each other more than to protect themselves. It turns out that in the lower 48, that's not the way people really thought about it. So it's difficult to market a vaccine like the COVID-19 vaccine to a general population in the lower 48 and say, you're going to take this to protect the people in your community instead of you're going to take this to protect yourself. Like, this is going to make you healthier and help you fight the virus. But from what we saw in these interviews, everyone was very focused on that community aspect more than anything else. And in fact, from our survey data too, we were able to see that interviewees saying that they were more focused on community and they were more inclined to trust the community governments, really, the local level governments more than even necessarily the state, more in reference to the state governor and not the state health organizations, but also the federal government is supported by the survey data. So people were really working on these more local levels. The survey data show that in terms of risk perception and public health messaging from these different authorities, between the spring of 2020 and the winter of 2021, trust in the US federal government significantly declined in that period, as did the trust in the state government. But the trust in Southeast Alaska local governments increased significantly during that time period. We also measured this in terms of, yep. Let's see, I can barely see. I'm so sorry about this. Bear with me, I'm sorry, these are back pocket slides. Okay. Yeah, so trust in local Southeast Alaskan government public health messages were significantly higher than federal and state at both times. And also, we were not able to find significant differences between Alaska Native and Southeast non-Alaska Native responses, although this could be a product of the sample size, or we don't know, it could be real, but we would have to look more into that. And now, quickly, I just want to finish up by being a little vulnerable and telling you where we're going next with this information. In the interviews, like I already said, people discussed that they delayed seeking medical care in part because of trust in public health messages and where they were coming from. And a lot of people discussed the mixed and confusing and untrustworthy nature of public health messages from federal and state authorities compared to local authorities. And early in 2020, the Arctic Council said, you know, we already know that this is a problem, basically. But in Southeast Alaska, from the survey data, what we were able to find is that over 80% of people from both large and small communities said that they'd experienced delayed health care for some reason. And I just want to quickly say why we're interested in delayed care, because many more people will survive pandemics than will not. And we know that they're extremely disruptive epidemiological events, and that people who are never infected with the pandemic pathogen or exhibit advanced symptomatic disease could still suffer indirect health consequences because of consequences of delayed care. And finally, we know that there could be behaviors, environment, and systemic barriers to access that lead to delays in emergent care for chronic conditions or even emergent ones in populations that could impact post-pandemic population health. And I'm not going to go through all this. I mean, this is just data showing how serious this problem is already. You know, a third of people delaying care for cancer treatment, even though most of them are concerned that they'll have health consequences because of that, massive delays in emergent health care. You know, 2/3 drop in cardiology visits, reductions in chemotherapy and immunotherapy and cancer diagnoses. And a lot of these data are coming from the clinical setting, which I think is really important to recognize, because these are physicians who are saying, this is the data we have, this is what we're observing. A lot of people have not been seeking care or have been canceling appointments for XYZ reason. And some of the reasons they've come up with have been public health mandates, so social distancing, you know, don't come to the hospital, overburden of hospitals and clinics, and personal risk assessments, so personal choices, essentially. And people have been characterizing the first two as involuntary care disruptions. And again, these are from clinical data. These are explanations of why these are happening from a biomedical perspective. But something that we want to emphasize as social scientists, and from what we've observed in Southeast Alaska, there are going to be lots of layers of determinants to this. So things associated with intersecting marginalized identities and stigma, environmental barriers, and intergenerational health that can further limit access to medical care and the ability to access it if you do seek it. And I just want to conclude by saying, so far, this is the only data that we know of that have really looked into delayed care in Alaska so far, and I think that this is going to be an important pathway forward as we hopefully move into a post-pandemic period. We're not quite there yet, but it could be really important because this is really an indirect and less visible population health consequence of pandemics that we need to look into from a more diverse and holistic perspective. And so I just want to recognize the funding that we've gotten from the National Science Foundation for this work and the RAND Corporation and our partners at the Central Council of Tlingit and Haida for, it wouldn't have happened without their involvement. So we would really like to extend our thanks to them. And